Thought I was in great health. I was walking every day, running occasionally. I was a type 2 diabetic, but I wasn't aware of any problems with it. I was told after the fact, over and over again, by a variety of doctors that my case was interesting, which I discovered you never want to have doctors tell you your case is interesting, because they said I was too young and too healthy to have a clot this big and apparently very, very old. I got up at 7 in the morning. I generally get my girls to school at 7:45. My wife decided to take the girls to school that day. At about 7:30, my leg became cold, numb, and the pain was the most intense thing I had ever experienced. I knew that I wasn't well, and I was able to call my dad because I knew I wasn't able to drive. He drove over from his house and took me to the emergency room right then, and was told that they might have to cut off my left leg. I was referred to an interventional cardiologist in Roswell. She got me in the cath lab, and they got a good handle on the size of things, clot-wise. I've got a friend who is an interventional radiologist in Roswell, who, when he got a look at those images, he described it as a very serious, very bad situation. And he's not a man known for overstatement. So I knew I was in big trouble. The interventional cardiologist who took over my treatment was very confident that with this procedure that she learned down here in El Paso, that she would be able to restore the blood flow to my leg, and she did. And it was amazing to see the change going into that procedure and coming out. My leg was white, it was painful, and I came back and the color had largely been restored. Because of the massive size of the clot and the amount of clot buster that they had to use, I was developing rhabdo, which, as I appreciated, is your blood becomes acidotic and it's pretty bad for you. The hospital I was in Roswell didn't really have the nursing care to keep me monitored the way I needed to be, so I was transferred to another level 1 trauma center in Texas to have that situation monitored and to be cared for on a going forward basis. While I was there, a vascular surgeon at that facility decided I needed another set of surgeries on my left leg using what I would call a more antiquated procedure, using Fogarty's to try and remove clots in the leg. And I can't really tell you how that went or not, but what I can tell you is I was discharged from that hospital without having had a blood flow test on my leg. And when I got back to Roswell, my interventional cardiologist was concerned that that test had not been done. Got me on the cath lab again and discovered that there was little blood flowing below my knee into my foot. And she was convinced that I was going to lose my foot at that point. She decided that I needed to get very expert help and told me about a physician down here in El Paso who had a great experience in this procedure. They medevaced me down, and the next day, the doctor performed the surgery. And to put it in perspective, my foot was purple and black in places. And when I got out of that surgery, my leg looked as normal as it could under the circumstances. It was night and day. And I'll tell you the relief that I felt knowing that I had turned the corner for the first time in a very legitimate way, that I was going to get through this. I was very fortunate to be referred to a physician who had been trained by physicians here in this procedure. It's a luck of the draw. If I had drawn a different interventional cardiologist or a different vascular surgeon, I might not have my left leg. I think you always want to explore your options with your surgeon before you start letting them cut on you. You know, it's amazing, given what the standard of care is out there, that I still have a leg. There's a lot of doctors out there who are not aware that there are alternatives available to cutting off a limb. I owe you my left leg, and there's not anything I wouldn't do for this team, because every day that I get up and I'm able to go watch my girls play soccer and do that with them, that's a gift that I wasn't going to have otherwise.
Cardiologist in Roswell, she calls me that there is a patient who was admitted to the hospital with acute limb ischemia, meaning that suddenly the leg was severely painful. And she did an angiogram, and he had a lot of clot all of his leg. So she tried to remove as much as possible, but still had a lot of clot left over. So they have some connections to another medical center. So she referred him to some of the physicians, surgeons over at that medical center. Subsequently, she saw him back about a week or 10 days later, and he continued to have significant pain, and he was having some changes on the foot. Now gangrene was setting into the toes. He was in severe pain. He was on multiple medications, and you could see that he was just severely uncomfortable. So under that circumstances, she repeated an angiogram, and again he had no flow to the foot. All arteries were occluded. So she did send me some images, and obviously I said yes, sure. He was transferred to our medical center, and it took me 2 days. He still had a lot of clot, some old clot. So there are a lot of technically related things when clot is 3-4 weeks older to remove it. Anyway, by the end of the second day, he had excellent flow all the way to the toe. You could see that next day his toes were pink, and his pain was suddenly much improved. We saw him today here as a follow-up, and it's just amazing that he is on no pain medicines. And he is able to walk. He still limps a little, but significant improvement. And he has not lost even a single part of his foot. He has all the toes, everything is improved. So this is where you can see that how much difference we can make in somebody's life. So I'm very, very happy and very, very proud of my team. Obviously, I'm a part of the team. I have a team, CLI team, which has really helped me to grow this kind of system, because after I finish my part, it's not done, because we need a rehab, we need a lot of other follow-ups, which my team does. So he has an excellent flow, and I think as long as he keeps taking his blood thinning medicine, I don't think he has any chance of having this again. So after that, I have a few times conversation with Dr. Rivers, who's his cardiologist, and she's very happy with the outcome. So she works with the podiatrist, and they see how the outcome is. And because of this, our relationship has strengthened. And she has told me that now our medical center is the first center where she's going to refer patients with this kind of a disease. And this is what we want to do. We want to be a help to any of physicians who have patients with this kind of a disease, acute or chronic. Before anybody recommends amputation, we would like to have at least one chance to see if we can at least decrease the level of amputation, or we may be successful in salvaging the limb. This is our hope, that the word gets out as much as possible, because the condition he had, the time is the essence. And if nothing is done within few hours, they can lose their limbs. So emergency room physicians, to diagnose correctly that this is an acute limb ischemia, and then they have resources to refer to the right people. And as far as the physicians are concerned, obviously there are many physicians that are doing these procedures, but we want to be helpful in case they think we could be helpful. because we do so many and we have so much experience that I think that having the whole CLI team here is much more important than a single person. Well, my gosh, I can imagine if I was at his place and if I lose my limb, my life won't be the same. So it's a huge impact on somebody's life who has many, many more years to live to lose a limb, which could be salvaged. So I have no doubt that it has really impacted his life.
So even though Mr. Williams' medical journey didn't start with us here at the Hospitals Providence in El Paso, we were fortunate that his physician did know about our program and referred him very quickly. And we were able to successfully treat him, revascularize his leg, and save his leg. And he is now walking. I think the most important thing is identifying that there are more advanced treatments and techniques that our physicians here are very capable of providing. And we have very specialized vascular specialists within our CLI team that are able to revascularize almost any patient and open up the arteries, improve the circulation to patients' legs, and ultimately save their limbs. So I think that it's very, very important that the referrals happen quickly. And we've set up a system where it just takes a phone call. We have a CLI hotline that can be accessed, and somebody will get them an appointment within 24 hours generally, depending on the severity of the condition. And so we've set up a no-fail system. I think we just need to get the word out and make physicians aware that they can refer patients quickly. We will get them seen and treated very quickly. And the goal is just to restore blood flow to the leg in order to start to heal wounds and start to improve their recovery process. I think it's incumbent on the medical community as a whole that we change the standard of care. Amputations generally are very quick to refer patients for amputation when they see non-healing wounds, necrotic toes. And so patients are generally referred to orthopedics immediately. I think that we need to change that mindset and really educate our medical community to realize that we have new techniques and new treatments that can restore perfusion and blood flow to the leg, that can save these patients' legs and improve healing process. And through our process of the whole circle of care, with follow-up and with caring for these patients, we can get them through the process of wound healing and follow-up and just restoring their overall outcome and well-being. It's very important that patients be referred very quickly. The implications of amputation are very, very severe. 50% of patients who have an amputation die within 1 to 2 years. In this country right now, more than 60% of patients who have an amputation have never had any vascular studies done. So patients are being amputated without ever even knowing if they have adequate blood flow to heal a wound. They're never given a chance, and all we want is for these patients to be given a chance. There's no reason a patient should have an amputation without first having significant vascular studies done and without being given the opportunity for wound healing. And it's not an easy process. It takes months. It takes a very dedicated podiatrist as well. Very important to our team are the wound care physicians and the podiatrists who treat them after, because they're doing the surveillance on these wounds. They're treating them, they're doing HBO and providing debridement and whatever care the patient needs throughout the process. And as soon as they see any issue, they refer back if there's another vascular insult. And so it's really important to have a team approach, to have a strong CLI team that includes a strong wound care team, and to have physicians who are helping us in treating these patients overall. It's an incredible circle of care, in getting these patients healed. The impact on the quality of life when you prevent an amputation is incredible. They're able to, their quality of life is improved. They're able to spend time with their families. They're able to continue to work and be productive members of society.